TBI issue. Introduction of research question. What are the genetic, historical, and habitual factors that affect the likelihood of suffering a concussion, and how can those factors be ameliorated to combat the increasing prevalence of TBI, or traumatic brain injury? Definition of TBI. Traumatic brain injury is the broader name for 5 different brain injuries: concussions, contusions, coup-contre-coup, diffuse hexagonal, and penetration. The difference in such injuries can be attributed to the different types of and amounts of force to the head, which can affect one area, various areas, or all areas of the brain. A concussion is the result of the brain suffering trauma from an impact or sudden change in momentum, which causes the brain's blood vessels to stretch and cranial nerves to become damaged, further resulting in brain edema or swelling. A contusion is a bleeding bruise on the brain and is the result of a direct impact to the head. A coup-contre-coup is when an injury results in a contusion on the side of an impact on the brain and a contusion on the opposite side of the brain. A diffuse hexagonal is the extensive tearing of the brain, releasing chemicals generating additional injury as a result of a strong rotation to the head. A penetration occurs from an object piercing or fracturing the skull, which ruptures the brain. This research project will focus on the concussion, which is the most common form of TBI. The short-term symptoms of a concussion are headache or feeling pressure in the head, temporary loss of consciousness, confusion or foggy thoughts, amnesia of the traumatizing event, dizziness, nausea and vomiting, and fatigue. Meanwhile, the symptoms that can be experienced hours after sustaining a concussion include concentration and memory difficulties, irritability and personality changes, light and noise sensitivity, trouble sleeping, depression, and taste and smell disorders. Long-term symptoms include post-traumatic headaches and vertigo, post-concussion syndrome, in which the patient experienced the previously listed concussion symptoms months after the injury, cumulative effects of multiple brain injuries which could cause mentally impairing conditions to occur, and the rapid, sometimes fatal brain swelling as the result of a secondary impact known as second impact syndrome. Repeated blows to the head and concussions can result in CTE, a degenerative brain disease with symptoms of memory loss, confusion, personality changes, depression and suicidal thoughts, aggression, and difficulty operating vehicles. Rationale for my project. In November of my brother's junior year, he received a blow to his head playing hockey whilst trying to retrieve the puck from a scrum off of a face-off. Brother left the ice and was officially diagnosed with a concussion that same night. We all thought that it would only be a minor setback. However, my brother wouldn't play another game his entire junior year and limped academically through the school year as chronic headaches persisted until late May. My brother fortunately returned to the ice for his senior year, but he wasn't in prime form following a year-long hiatus from hockey. His headaches would occasionally return 5 years after the incident. One 10-second play with a barely noticeable blow was all it took to ruin my brother's high school hockey career. Prevalence and causes. Prevalence in 2014, approximately 2.87 million TBI-related injuries occurred in the U.S., contributing to nearly 50,000 deaths, accounting for 30% of all injury-related deaths according to the CDC. The leading causes of TBI in the U.S. in 2014 were falls, which accounted for 48% of brain injuries, getting hit by an object accounting for 17%, and motor incidents accounting for 20%. According to the University of Pittsburgh, from 2001 to 2013, more than 62,000 high school athletes suffered a concussion while playing contact sports annually, and thousands of bikers and incidents were sent to hospitals with head injuries as well. American football in particular is known to have a large concussion problem. However, there are sports that have concussion problems that many are unaware of. For example, the concussion rate in women's hockey, in which hitting is illegal, reports nearly a 3 times greater concussion rate than in men's American football. Factors. The most common historical factor that contributes to the likelihood of suffering a concussion is one's concussion history. A study from the Children's Hospital of Philadelphia and the CDC found that 1 in 6 children aged 5 to 15 who have suffered a concussion will experience another concussion with an increased number of symptoms and longer recovery time within 2 years of the first concussion. Neck size and neck strength have been suggested genetic factors for one's susceptibility to being concussed. Weaker and thinner necks are unable to absorb force as well as a thicker and stronger neck. Therefore, those with weaker and thinner necks have a greater likelihood of suffering a concussion. Experts believe this may be the reason that women are more susceptible to concussions as they typically possess thinner and weaker necks. There are many habitual factors that can increase the likelihood of suffering a concussion, as TBI can be sustained as a result of a variety of recreational activities, such as participating in contact sports or riding a bike. Prevention, rule changes, and equipment. In 2014, Riddell released a new technology in its newest helmet, which is called SpeedFlex. It is designed to reduce the direct impact to the head via its Insight Impact Response System, which essentially flexes a section of the helmet when receiving a blow to absorb a portion of the force of the initial hit. Senior Vice President of Research at Riddell, Thad Eade, claims that the flexing of the helmet, along with the padding inside of it, reduces the force of the impact more than if the helmet were completely solid. Similar to this helmet is the VC01, which essentially applies the concept used in the flexing portion of the SpeedFlex to the whole helmet. The VC01 features 4 layers of protection. An hour later, that compresses to absorb the shock, then rebounds after the blow similar to a tennis ball. Below this layer are polymer columns that move in various directions to absorb and distribute shock and force. Next is a hard inner shell to prevent skull fractures and brain bleeding, and finally a layer of memory foam for comfort. Instead of allowing only one area to be able to flex, the whole helmet is flexible, allowing for a larger range of protection. However, like the SpeedFlex, the helmet cannot prevent concussions caused by harsh rotations of the head, which accounts for the majority of concussions. An example of rule changes that were effective in the prevention of concussions is the recent rule changes to NFL kickoffs for the 2018 season. According to Mark Mask of the New York Times, the new rules included eliminating players on the kicking team from getting a running head start before the kick, creating a no blocking buffer zone between the two teams, and eliminating all forms of wedge blocking with 2 or more players by the returning team. The result of these changes has been positive, as concussions on kickoffs were reduced by 35% from 2017, and when compared to the average of the previous 3 years, concussions were down by 38%. The success of these rule changes discourages the NFL Rulemaking Competition Committee from completely removing kickoffs from the game, so the game does not have to radically change the way it is played. The XFL has made a few rule changes to football in order to combat the high concussion rate present in the sport while also ensuring a better viewing experience. The biggest change made by the XFL to kickoffs is that the kicking team lines up on the return side 35-yard line, except for the kicker who lines up at the opposing 30-yard line, and the return team lines up on the 30-yard line, and both cannot move until the ball is caught by the returner. Another significant change is that balls that are kicked out of bounds or fall short of the 20-yard line will result in a penalty putting the ball at the kicking team's 45-yard line, and if the ball is kicked into and then downed in the end zone, it results in a major touchback, and the ball is placed at the return side 35-yard line. These rule changes are meant to eliminate the 30-yard sprint between the kicking and return teams, while also encouraging more returns instead of touchbacks. The XFL has also made extensive rule changes to punts as well. The punting team cannot pass the line of scrimmage until the ball is punted, and if the ball is punted out of bounds inside the 35-yard line, inside the opponent's end zone, or past the opponent's end zone, it results in a major touchback placing the ball at the 35-yard line. These rule changes should encourage teams to punt less, as punts within the opposing territory will likely end in a major touchback, and encourage more returns rather than fair catches, since there will be more room to return because the punting team cannot run towards the returner until the punt is kicked. Also, gunners should be moving slower because of this change, which should improve player safety. Dartmouth football's solution to preventing concussion looks not to change how games are played, but by changing how the game is practiced. In 2011, head coach Buddy Stevens told his staff without asking for their opinions first that they would no longer partake in live tackling during practice. Of course, this decision was initially met with resistance from the staff as they thought it was an idiotic idea that would get them all fired. But Stevens said in reply, "Either we change the way that we coach the game or we're not going to have a game to coach." The results of these changes have been positive in every way, as all injuries went down 80%, the concussion rate fell 58%, Dartmouth won 76% of its games since 2014, and most surprisingly, the team missed 50% less tackles. The changes Dartmouth made to its practices haven't sacrificed any performance while greatly improving the safety of their players. Currently, there is no treatment for concussions other than both physical and cognitive rest. A patient must rest themselves over a varying period of time dependent on the severity of the concussion in order to recover, meaning that a patient must avoid activities that worsen symptoms. Patients who suffer from longer-term symptoms such as post-concussion syndrome from MTBI can take antidepressants to lift moods, painkillers to ease headaches, and physical therapy to help with dizziness, but none of these treatments actually help heal the brain. Eventually, all symptoms will dissipate and the patient will be able to return to sports activities. Because there is currently no other way to speed up the recovery process of a concussion, companies are starting to try to create new treatments to shorten the recovery process. One example of this is Tektrom's ProtoCool device. The device is essentially based on the same medical concept of icing injuries to limit edema. The ProtoCool system resembles a headband that wraps around both the head and neck, and once the bands are in place, the device cools the brain. The device is currently undergoing medical trials, so whether or not the device is effective in aiding the recovery process of a concussion is yet to be determined, but if the trials do determine that it is effective, then it would be the only proven additional treatment for concussions other than rest. Possible advancement in the treatment of TBI is the use of hyperbaric oxygen treatment HBOT to help heal the brain. HBOT exposes patients to pure oxygen at a higher than normal air pressure, which could help heal the injury since many believe that the brain does not have enough oxygen to heal itself. In 2012, a study was done by medical professionals regarding the effectiveness of HBOT on MTBI and post-concussion syndrome or PCS symptoms. The report found that HBOT at a pressure of 1.5 ATA, or atmospheres absolute, for 40 sessions over 60 minutes over 30 days was effective in the alleviation of symptoms from MTBI and PCS. Tests on subjects found that there was a significant improvement of symptoms in IQ, short-term memory, reaction time, attention deficiency, PCS symptoms, TBI symptoms, depression, anxiety, and self-reported feeling of being normal. Many have looked towards traditional Eastern medicines for the treatment of concussions as well. Tony Magna, who played football for the University of Wisconsin before ending his college career early due to repeated concussions, has been administering acupuncture to those who have suffered concussions or other TBI-related injuries. Magna believes that acupuncture and other traditional Chinese medicines are capable of healing the brain's process of restoration, not just masking the pain. Dr. Lauren Grossman, MD, MS, claims that Chinese medicine can be another viable way of combating concussions, but it typically takes 4 to 6 treatments rather than one dose to determine its effectiveness for a specific patient. Many of Magna's patients declare that acupuncture treatment is effective. One doctor named Dr. Mark L. Gordon suggests that personalized treatment is the best approach to tackling the treatment of concussions. He has developed innovative approaches for the assessment and treatment of various forms of traumatic brain injury, which are summarized in his new website service called TBI Help Now. He claims that in order to treat TBI successfully, the brain's hormones, neurosteroids, must be restored to their optimal levels while also reducing neuroinflammation. His program consists of results from 30 common lab tests that will be used to create a personalized treatment of allopathic and naturopathic medicine, and it possessed a success rate of 75% within 12 months. Thank you for listening to my presentation on my research project. Feel free to ask me any questions that you may have. Bye.